Workplace injuries can occur in any occupational setting. Employees face workplace hazards that could cause harm to them or to fellow employees. Additionally, employees can be injured due to accidents and health-related problems. Even when employers take precautions and implement safe work practices to prevent workplace accidents and injuries, there is still a chance they could occur. Employees need to be prepared and know the proper steps to take when an accident or injury occurs. Knowing the correct procedures to follow could minimize the injury and even save a life. This program is designed to help employees know what to do in an emergency situation and how to administer correct first aid when required. This program is not a comprehensive training program for each topic covered. Its purpose is to provide an accurate but brief overview of the various topics discussed. The contents of this program include first aid, blood-borne pathogens, cuts and scrapes, burns, chemical exposures and burns, broken bones, heat exhaustion and heat stroke, choking, and cardiopulmonary resuscitation, or CPR. First aid is described as limited care for an illness or injury. Many times, first aid is administered by an individual or individuals until trained medical personnel arrive. While not all injuries or illnesses require treatment beyond first aid, some injuries or illnesses require immediate trained medical attention. Most first aid consists of a few simple steps and procedures which can be performed by an individual who has received minimal training. The goal of first aid can be summed up in 3 points, known as the 3 P's of first aid. Preserve life. This is always the focus of those who provide first aid. When determining the steps one needs to perform in order to help, always keep your own safety in mind. Never put yourself in danger. Prevent injury. Preventing the victim's injury from getting worse and preventing additional injury from occurring is very important when administering first aid. If possible, remove any hazards from the area to make it safer. If it is not feasible or possible to remove the hazards, you should move the victim to a safer place. Only move a victim if absolutely necessary, and only if it will not cause the victim additional harm. Promote recovery. It is important to make the victim as comfortable as possible and quickly summon trained medical professionals. In many instances, this can be important to the long-term recovery of a victim. The sooner a person is properly treated, the less long-term effect any injuries may have. Know the number to call for medical help. This is generally 911. When administering first aid, be sure you give accurate information to the trained personnel, along with accurately describing what happened to the victim. It is also extremely important to know your location. First aid can also promote recovery. For example, chemical burns can continue to burn the affected area until the chemical is removed. Quickly flushing the skin with clean running water will remove the chemical and hinder any additional damage. It is important for all employees to know some basic information, such as the locations of all first aid kits, the location of the nearest eye wash station and emergency shower, and who is CPR certified in their department. Knowing what to do and reacting quickly is vital. As a matter of record, report every incident to your employer. The accident will then be investigated to help prevent it from happening again. It is advisable to get a tetanus shot as a preventative measure. Anytime a person is cut or wounded, they risk getting the painful and deadly bacterial infection. Doctors recommend one every 10 years. When dealing with any situation where blood might be present, it is important to protect yourself from blood-borne pathogens. commonly referred to as BBP. Blood-borne pathogens are disease-causing microorganisms present in human blood. These pathogens include, but are not limited to, hepatitis B virus, hepatitis C virus, and HIV. If contact with or splatter from blood or other potentially infectious material is reasonably anticipated, personal protective equipment should be worn on the potentially exposed areas of your body. It is especially important to cover mucous membranes, skin abrasions or cuts, and your hands. Many employers have a blood-borne pathogen kit near the first aid kits. Some basic forms of protection include gloves, aprons, mouth and eye coverings. PPE should be used anytime blood or other body fluids are present. Remember, preserve life. Never put yourself in danger. Minor cuts and scrapes can usually be treated without a trip to the emergency room. It is important to treat them properly, though, to avoid infection. If the cut is from an animal or human bite, you should seek professional medical attention. Here are the steps to take to treat minor cuts and scrapes. Stop the bleeding. Apply pressure to the area and, if possible, elevate the wound. If the cut is bleeding severely, blood spurts from the wound, or the bleeding will not stop after applying pressure for 10 minutes, you should seek professional medical help. If the cut is deeper than 1/4 of an inch or is gaping open, stitches will probably be necessary. Having the cut properly closed reduces the chance of infection. Stitches should be administered within 6 hours of the injury. Clean the wound. Use clean water to rinse the cut thoroughly. Using soap or any type of cleanser could irritate the cut. A washcloth and soap can be used to clean the area around the cut. Apply medication to the area. An antibiotic ointment should be applied to the area to help the wound heal faster and to help fight off any type of infection. Dress the cut. Apply a bandage to the area to keep the wound clean. Change the dressing daily or as needed, and apply the antibiotic cream each time. Once the cut is healed enough to make an infection unlikely, remove the bandage. Watch for infection. Keep an eye on the wound area for possible infection. An infection can occur even if the wound has been properly cleaned and bandaged. If the area doesn't heal properly, or the area becomes swollen, irritated, or red, see your doctor. Some infections can be life-threatening. Burns to the body can range from minor to very serious. The treatment for a burn is based on its severity. You should know the extent of the burn before treating it. Generally, there are 3 classes or degrees of burns. They are first, second, and third degree. A first-degree burn is the least serious and involves the outer layer of skin. The skin will be reddish and there might possibly be some swelling and pain. Second-degree burns occur when both the first and second layer of skin is burned. Blisters will form and are accompanied by more severe pain and swelling. If the burn area is small in size, it can generally be treated in the same manner as a first-degree burn. A third-degree burn is very serious and involves all layers of skin and the fat layer beneath the skin. The burn area will appear dry and leathery with white or black charred skin and can completely destroy the tissues. Always seek immediate medical attention for any third-degree burn. Burns that require immediate medical attention are those that are located on the hands, feet, face, groin, buttocks, knees, wrist, or other body joint. Those caused by fire or are electrical or chemical in nature, and/or those larger than 2 inches in surface area. Basic first aid treatment for minor burns consists of the following steps. Place the burn under cool running water for approximately 10 minutes. Never use lotions, butter, creams, or egg whites to coat the area. Do not pop blisters which may have formed. Cover the burn with a sterile gauze bandage. Wrap it loosely. A pain reliever such as ibuprofen, aspirin, or acetaminophen can be taken if needed. Additional treatment is usually not necessary for the burn to heal properly, but if signs of infection appear, seek professional medical help. These signs include increased pain, red streaks from the burn area, oozing or pus, fever, swollen lymph nodes. As with any injury, be on the lookout for infections and seek medical treatment if the burn does not heal. A chemical exposure can create serious problems. A chemical can continue to affect you until they are removed from the exposed area. Reacting quickly to address the situation can help minimize the effects of the chemical exposure. It is important to rinse and flush the area with cool running water for at least 15 minutes. If the chemical is in your eyes, use an eye wash station. If it is on your body, the use of a safety shower is the best choice for rinsing. If they are not available, use the closest viable option, such as a hose. Avoid using a strong stream of water. Keep any rinse water from flowing onto other parts of your body and causing additional contamination or burning. As you rinse the affected area, remove any clothing or jewelry that may have the chemical on it. Never attempt to neutralize the area with other chemicals, such as using a base to neutralize an acid. Water is the only recommended rinsing fluid. Consult the chemical safety data sheet for first aid procedures or follow the directions on the container's label. With most chemical burns or exposure, you should seek professional medical treatment. Anytime you suspect a bone is broken, seek proper assessment and treatment by a medical professional. Some fractures are less serious than others and may not require emergency responders. In such cases, the victim might be able to see their personal physician or be driven to the ER. In other cases, immediate medical help should be sought. First aid can be utilized in less serious cases. Stop any bleeding by applying firm pressure to the area with a clean cloth. Do not try to push any bone back into place. Apply ice to the area to reduce swelling and pain. Never place ice directly on the wound, but instead use an ice pack or wrap the ice in cloth before placing it on the affected area. Immobilize the wound area, if possible, by placing a splint above and below the fractured area. If you are unsure how to place a splint properly, it is best not to attempt. Do not move the broken bone. Seek professional medical attention as soon as possible. Always seek immediate medical attention by calling 911 if the broken bone is the result of a major injury or trauma. There is heavy bleeding or bleeding won't stop after applying pressure for several minutes. A bone is protruding out from the skin. The injury is located in the back, neck, or head. Heat exhaustion is a heat-related illness which can range from mild muscle cramps to heat stroke if not treated quickly and appropriately. Heat exhaustion occurs when the body's normal cooling mechanisms start to fail and the body begins to overheat. Some of the things which can lead to heat exhaustion or heat stroke include extreme outdoor or indoor heat and high humidity, moving from a cool area into a hot area and not having adequate time to adjust to the temperature change, wearing heavy clothing and/or restrictive clothing during high temperatures, extreme physical work or exercise, not being properly hydrated. You may be more susceptible to heat exhaustion or heat stroke if you have experienced a heat-related illness in the past or are currently suffering from another illness which is causing diarrhea, vomiting, or fever. The most common symptoms of heat exhaustion include slightly increased body temperature, heavy sweating with cool, clammy, pale skin, feeling fatigued, faint, and/or dizzy, dark-colored urine, which is a sign of dehydration, dry mouth, muscle cramps, headache. Treating heat exhaustion is important. If not treated properly, it could lead to heat stroke, which is very dangerous and can be life-threatening. Move to a cool place inside or in the shade. Lie down and loosen clothing. Drink cool water or, if available, some type of sports drink. Avoid caffeine and alcohol, as these will make the condition worse. Eating a salty food such as a saltine cracker is beneficial if available. Massage and stretch muscles. Take a cool bath or shower. If after 30 minutes of treatment there is no relief, medical help should be contacted immediately. Heat stroke is very dangerous and can cause organ and brain damage and even death. Usually, heat stroke progresses from a milder condition such as heat exhaustion and is generally brought on by an extremely high heat index combined with dehydration. The body's normal temperature control system shuts down when heat stroke strikes. You may lose your ability to sweat. The main symptom is an elevated body temperature of 105 degrees Fahrenheit or more, and is accompanied by disorientation, nausea, and sometimes coma. Additional signs of heat stroke include headache, rapid heartbeat, shallow rapid breathing, lack of sweating despite the heat, fainting. Prompt first aid for any suspected heat stroke is essential. Call 911 immediately and then begin to administer first aid until help arrives. Move the victim to a cool spot in the shade or an air-conditioned building and remove any unnecessary clothing. Soak the body with cool water from a garden hose or with wet sponges while fanning them. Apply ice packs to the neck, armpits, and groin area to assist the body in cooling down. Provide cool water or other non-alcoholic beverage if possible. Remember, time is of utmost importance when dealing with heat stroke. Choking occurs when an object becomes lodged in a person's throat and can be a life-threatening situation. The airway may be partially or fully blocked. Since choking cuts off the flow of oxygen into the lungs, it is important to act quickly to dislodge the item. Brain damage can occur in as little as 4 minutes without oxygen. If it appears someone is choking, look to see if they display the universal sign for choking, which is grabbing the throat with one or both hands. If the person doesn't make the sign, watch for other indications of choking: an inability to talk, difficulty breathing or coughing, lips, nails, and skin turning blue, loss of consciousness. If the person is choking, provide first aid and have someone else call 911 if possible. Give 5 back blows using the heel of your hand to the section of back located between the shoulder blades. Perform the Heimlich maneuver by giving up to 5 thrusts on the abdomen. To perform the Heimlich maneuver, stand behind the person and wrap your arms around their waist. Make a fist and place it just above the person's navel with your thumb facing inward. Grab your fist with your other hand and pull quickly inward and upward 5 times. Alternate between 5 back blows and 5 abdominal thrusts until the object is dislodged. If the choking person is pregnant or obese, you should follow the same procedures except when doing the abdominal thrust. Place your fist higher at the base of the breastbone. CPR is a procedure used to temporarily maintain partial blood flow to the heart and brain in a person suffering from cardiac arrest or other emergencies where the person has stopped breathing and/or the heart has stopped beating. In such situations, it is better to attempt CPR than simply wait for trained medical help to arrive. Therefore, even untrained people are encouraged to perform a modified method of CPR. The modified method involves performing chest compressions only. First, gently shake the person on the shoulder and ask loudly if they are okay. Look for signs of breathing. If there is no response, call 911. Many facilities have an automated external defibrillator, or AED. If one is available, turn it on and follow the step-by-step instructions provided. An AED is an automated device which can analyze a person's situation and advise certain steps to take to help resuscitate them. It will also provide an electrical shock to try and restart a person's heart. If no AED is available, or after using the AED you are instructed to do so, Continue with hands-only CPR. Place the heel of your hand on the center of the person's chest. Place your other hand on top of the first hand. Keeping your arms and elbows straight, position your shoulders directly above your hands. Push straight down using your body weight, compressing the chest at least 2 inches. Then release the pressure, allowing the chest to rise. Repeat compressions rapidly at a rate of about 100 per minute. Continue until trained medical help arrives. In situations such as drowning and drug overdose, the traditional method of CPR, which involves chest compressions, clearing the airway, and mouth-to-mouth breathing, is the preferred method. If someone is trained, they should perform full CPR. Remember though, it is still better to attempt hands-only CPR than do nothing at all, even if you are not trained. This short training course has covered a few possible medical emergencies where first aid could help a victim, not only in limiting the injury and promoting a quicker healing time, but could even save a life. Additional in-depth training covering each topic is always a good idea. Remember, first aid is limited care for an injury or illness until trained medical professionals arrive.